Okay, this is part 2 of how to prevent a heart attack. And the first thing to be aware of is the higher the LDL cholesterol, the more red blood cells it's going to stick together, and the higher your blood viscosity is going to be. Blood viscosity means blood thickness. So what this really means is, think about a blood pressure. Why do you have a blood pressure? So you can pump blood to the top of your brain. You have to pump that blood against gravity. Now, normal blood's like water. But if the red blood cells are stuck together because of a high-fat diet, causing elevated LDL cholesterol, elevated chylomicrons, elevated triglycerides, they all stick red cells together. What's going to happen then is that your blood's going to be thicker. Your heart's going to have to pump at a higher pressure to get it up to the top of your brain. And if you eat high sodium, dietary sodium, that's a vasoconstrictor, inhibits endothelial nitric oxide synthase. You drop your nitric oxide production, means you drop your vasodilator production. Your arteries will constrict. So now you're pumping thick blood through a constricted system, pressure goes up, okay? So that's bad. The higher the blood pressure, the more it's going to damage the arteries, and that's going to cause atherosclerosis. I'll explain how that happens in a moment, but that's how it all works. Okay, now here's a picture of a red blood cell. Typical red blood cell is about 7 microns. You want to know that. Red blood cells, 7 microns. That's important to know. Typical capillary is about 5 microns. That's important to know. So basically, a normal red cell is bigger than a capillary. That's why a normal red cell has to fold back on itself to pass through a capillary. So it has to have some flexibility to pass through that capillary. All of those are important basic components about blood flow. You should know that. Okay, here's just another picture that's basically showing the same thing. When you have a bridging molecule sticking the red blood cells together, now it's like pushing a submarine sandwich through that capillary. You're going to have to push higher pressure to get these blood cells through the capillary. You're going to get decreased tissue oxygenation as well. All right, here's showing something from the paper of Peter Quoll, way back in the 1950s in Philadelphia. He was a cardiologist, and he took his cardiac angina patients and he fed them high-fat meal, and he tracked their blood lipids. He drew blood from them every 30 minutes. And what he noted at peak lipemia, highest level of fat in the blood, there was about a 20% drop in oxygen delivery to the tissues. Later on, Roy Swank repeated this in hamster brains, got a 30% drop in blood flow in their brain. Meyer Friedman and Ray Rosenman were 2 ophthalmologists who repeated this with PUFAs, polyunsaturated fatty acids. The work here at Quoll was done with SAT-FAT because, he's inspired by the work of Ansel Keys, and he helped confirm the work of Ansel Keys. And then later on, like I said, the ophthalmologists, Ray Rosenman and Meyer Friedman, confirmed the same thing with PUFAs were just as bad or worse. They actually caused more prolonged blood sludging, elevated blood lipids. And the patients would get recurrent episodes of cardiac angina around the time of peak lipemia from around 4 to 7 hours. Okay, so that's bad. When you fed them just carbohydrates, they never get lipemia in the blood. Okay. So this black line is SAT-FAT, peak lipemia here, then it comes down. And the red line is PUFAs. PUFAs caused even more prolonged blood sludging. So they're real bad. PUFAs are terrible. You don't want to eat them, okay? Anybody on the internet trying to tell you PUFAs okay, they're full of crap, all right? Okay? I'm a Christian. I'm not monetized. I tell you the truth. My goal is to try to be the best doctor in the world. I think I already am. And I just tell you this because almost all the people on the internet I see, including a lot of the famous ones, are all bullshitting because everybody's trying to sell you some nonsense. Oh, olive oil's okay. Canola oil's okay. Omega-3s are good for you. It's all horse crap, okay? You want to minimize your dietary fat as much as you can. What they do is they try to overwhelm the truth because they got money, they got sponsors. You can take a piece of crap lying video and you can put corporate money behind it and it'll get shown to millions of people. Okay. Then I sit here and I tell the truth and I'll get, 100 views for this. William C. Roberts shows his autopsy studies that coronary artery disease is always diffuse, single vessel disease is a myth. What does he get for that? He gets about 40 views, okay? So the truth is kept silent. It's kept hidden from the pros. Okay, here's showing the hematocrit. The higher the hematocrit, meaning the percentage of red blood cells in the blood, the higher the blood viscosity. Because over 99% of blood cells are red blood cells. Okay, those are the oxygen-carrying cells. Those are cells. They're basically a bag of hemoglobin. A red blood cell doesn't even have a nucleus. Okay. So anyways, when you look at a test tube full of blood, the red blood cells sediment out to the bottom. That's the hematocrit. The white blood cells sit in the middle. They sometimes call it the buffy coat. And then you have plasma above, little yellow stuff. You can see when somebody eats a high-fat meal that the plasma will cloud up with the fat. You can see that in that movie Game Changers, that vegan documentary, so to speak, showed that. Oh, here it is, too. I draw a picture of it. So here it is becoming opaque. And again, nice picture of this in the vegan movie called Game Changers documentary about the benefit of a plant-based diet. Normal plasma is translucent, typical hematocrit. Let's say it's in the ballpark of around 44%, 40 to 44%, like that. Okay. Now here briefly is a little bit about diabetes. Well, I'll just tell you, diabetes is a disease of fat. Just remember that. Fat is bad. Nathan Pritikin said that a long time ago. David Blankenhorn said that a long time ago. Dr. McDougall said that a long time ago. The more fat you eat, the more atherosclerosis you get. The more fat you eat, the more diabetes you get. The more fat you eat, the more hypertension you get. You want to minimize dietary fat. Okay, and then this is also somewhat of what you would call the ectopic fat theory, and sort of that was largely developed by Gerald Shulman. Conceptually, I made it into stages. He didn't do that, but it's basically the same idea. And what's the point of it? Basically, the fat first accumulates in the skeletal muscle. That causes insulin resistance in the skeletal muscle. Normally, after you eat, the fat goes. The fat in the skeletal muscle will cause insulin resistance. What's called postprandial. Prandial means eating. Postprandial hyperglycemia is what you get from fat in the skeletal muscle. Then it accumulates in the liver. The liver loses its ability to sense blood glucose accurately, and it'll start to keep pumping glucose into the blood, even when you're no longer, even when you got a normal blood glucose level. So that means you'll have even fasting hyperglycemia. And you'll keep on accumulating more fat in the body. You'll start accumulating fat in the beta cells of the pancreas, and it'll damage them, and they'll be less able to produce insulin. You'll eventually just burn out your beta cells, destroy them, and then you won't be able to make insulin at all. Then you become a fully dependent, insulin-dependent diabetic type 2. Okay, and then you start getting all these other complications of diabetes. All right, so anyways, we're going to leave it at that for now, but you learn some important lessons here. Minimize dietary fat, and you will minimize atherosclerosis. Minimize dietary fat, and you will minimize diabetes. Minimize dietary fat, and you will minimize hypertension. This also helps good to reduce your dietary sodium. So that ain't rocket science. Anybody can learn that. That's not in any, all the stuff I told you, none of it is in the medical books. This is... all your doctors, including the AOAs. AOAs are top 10% of the class. They won't know this. Okay, this is above them. Okay, that's what I think it's funny. I can talk to a bunch of pros with no medical background whatsoever and teach them more about atherosclerosis, coronary artery disease, diabetes, and hypertension in a half-hour video than what doctors learn in 4 years of pre-med, 4 years of med school, 3 years of residency, 3 years of fellowship. I'm not kidding. They don't know this. It's pretty basic. Anyways, I hope you found that helpful.